Hello and good evening, listeners. Welcome to our weekly English program, Kaleidoscope. Listeners, in our today's program, we have an interview with Dr. Santosh Ghatpande on the topic Music Therapy Catching the Rhythm of Life. And the interviewer for this program is Ketaki Gadre, who is a music enthusiast and a digital marketer by profession. So let us listen to the second part of this interview.
Hello listeners, we have started our session with this music which is specially designed for stress relief. I am Ketki and I would like to welcome you again to the second part of our conversation about music therapy. We are discussing an interesting topic called music therapy and we have with us Mr. Santosh Ghatpande, an expert in this field. In the last session, we got information about what music therapy is and that it is not necessarily for patients but for general well-being of everyone. Continuing, my next question is, so what ailments or diseases can be cured with music therapy?
Yeah, so the range is very high. Actually, the range is very large. Firstly, let's talk about some of the psychological diseases or disorders. The range can include anything like ADHD, some of the things like fear, insomnia, sleep disorder,
Right.
or we can also talk about schizophrenia, dementia, Alzheimer,
Okay.
all the spectrum of autism.
Okay.
All these are psychological, I would say, disorders, and there are people dealing with that. Music therapy certainly helps in improving the condition of these patients in a psychological spectrum. Sometimes the disorder is not very termed kind of thing. So things like fear or things like lack of confidence are not termed as disorders, but music therapy is equally applicable in these ailments as well. The second set of diseases or ailments is the physical disorders.
Right.
Example is diabetes, blood pressure, heart problems, cancer patients, or digestive disorders. All these are examples, and this is, by the way, not the exhaustive list. So, for giving examples, I am just citing out some of the diseases, but the range is quite high.
Right.
And while introducing music therapy in all these diseases or ailments, we never ask the patient to stop the current medication.
Right.
This is very important point.
Yes.
Music therapy coexists with all the other therapies. So the medication is not stopped. What happens with the introduction of music therapy is the medication impact is increased, and also with the introduction of music therapy, with a certain period or after some time, the medication is reduced,
Right.
and the person can sustain on music therapy as well.
Great. This is huge actually. Right.
Yes.
So for getting any kind of positive impact, how much time or how many sessions are required to be attended?
Yes, so that depends on case to case.
Okay.
A typical music therapy cycle is for 60 days,
Okay.
but how many cycles to be repeated depends on the severity of the case. So when we understand the person's case history, then it's decided that one cycle is enough, or there needs to be a repetition of cycles. And you can understand that this therapy is not something that that is painful or that is having any kind of side effect
Right.
or any kind of overdose. So
Right.
these two are very important factors of music therapy. Music therapy never has any side effect or
Correct.
no overdose, because we are not intervening in the body.
Correct.
Okay, so you can continue even if
Correct.
you are sustaining, the problem is reduced.
Right.
Music therapy can be continued.
Right. So it is a new information that music therapy is beneficial in diseases. So can you share some examples?
Yes, so probably from the 4,500 plus case studies that I have completed, I can choose some of the examples
Right.
which can be cited here. I'm specifically choosing these examples so that listeners can understand the exact application. One of the example is of a lady who is a senior citizen who is dealing with insomnia, which is sleep disorder for almost 20 plus years.
Oh, okay.
And you can actually understand that sleep disorder is a impacting disease and it impacts the entire life of a person. If you are not getting enough sleep, then your entire life is disturbed. And there are so many physical disorders which are carried out because of this root cause.
Right.
I worked with this senior lady for 4 months, so 2 music therapy cycles almost.
Okay.
And after that, she has called me and told me that she's getting a good 6.5 hours of sleep in the night for the consistent period, which is a month or so. So music therapy can have this kind of impact.
Right.
Another example is of a student who is studying in Pune and he has attempted suicide for 2 times
Okay.
because of the pressure that he has to deliver. He has to give exams, he has to pass, and he has to deliver. So that's a pressure that has built, and that's where the suicidal attempts were done. When we introduced music therapy, I just removed all the music from his phone and introduced a designed music in the phone, and I just asked him to listen to it for consistent period of time, and there are other techniques as well. After 3 months of intervention, these people usually shy away. They are not going ahead and giving any feedback.
Right.
But this student came forward and he has shared a video feedback wherein he's saying that now he is ready to give exams. He's back to life. And which is the motto of that case.
Yeah. Right.
Result of the exam was not important. He can pass or fail, but giving exam, readiness to give exam was something that was required. There are cases in the areas of diabetes and blood pressure as well. Especially diabetes cases, there are proven and recorded results wherein the HbA1c levels have come down from diabetic conditions like 7.58 to 5.5, which is a non-diabetic level.
Yeah. Right.
So these are some of the cited examples which we can consider as an transformation.
Right.
Yes.
Right. So apart from individuals, where do you see music therapy can be used in other groups?
Yeah, that's a good question because till now we have been talking about individual, their history, their problems and objectives. But music therapy is also applicable in some of the other important aspects. Like we can also design music therapy for clinics.
Okay.
I have personally worked for dental clinics, especially. Dental clinics is an area where all of us have experienced the pain
Right.
and the fear that a person goes through. So dental clinic is an area. I have also designed music therapy for a gym. So people go to gym for certain kind of motivation and all the other things. So gym is another important area.
Right.
Restaurants is another area wherein a designed music, if played, can have very important impact and positive transformation. We also apply music therapy in corporate world, especially techniques like drum circles and other things can have team building and team bonding impact for a corporate people.
Right.
Also, stress management techniques are very important for a corporate world. So these are all the group activities or group areas wherein music therapy is equally applicable.
Santosh sir, this was a really great conversation. Thank you so much for coming. So what will be the better conclusion than listening to a therapeutic music?
Okay. So what I'm going to do is let's play a music which is a demonstration of a technique in music therapy. This is called musical imagery. So while the listeners will listen to this music, I would request all of them to close your eyes, and I'm damn sure that you will see something very beautiful and different. So close your eyes, focus your energies on ear as sensory organ, and listen to this music very carefully. While listening to music, you will see something beautiful. So after we are done, you can draw whatever you have seen while listening to music. You can draw your pictures, you can represent it in a pictorial format, and you can put it on the Facebook page of Akashvani Pune in response to this session. Thank you.
So listeners, that was an interview with Dr. Santosh Ghatpande by Ketaki Gadre on the topic Music Therapy Catching the Rhythm of Life. This was the second and the final part of the program. Hope you enjoyed listening to this program. We will be back next week with another exciting program. Until then, thanks for listening and please stand by as our next program follows.